Did you know your ears can indicate your health? Quite a surprising fact, isn't it? But it's true. Our bodies are intricately designed, and every part, including our ears, can provide subtle hints about our overall health. These are known as ear health indicators. And while they might sound like something out of a science fiction novel, they are very real and can offer valuable insights into our well-being. Our ears are not just there for us to enjoy the sweet symphony of life. They are like individual health radars, constantly picking up signals and symptoms that could point to something more serious. The importance of paying attention to these signals cannot be overstated. These ear health indicators are our body's way of communicating with us, telling us when something might be off balance. So, what are these indicators you should never ignore? Let's find out. First up, the earlobe crease. This seemingly innocuous feature could be a potential indicator of heart disease. Yes, you heard that right, heart disease. Medical studies have shown a correlation between diagonal creases on your earlobes, known as Frank's sign, and an increased risk of heart disease. This was first noted by Dr. Sanders T. Frank in the 1970s. He found that a crease on one or both earlobes could be a sign of coronary artery disease. How does this happen, you may wonder? The theory is that the same processes causing blockages in the arteries can also cause a crease in the earlobes. Of course, correlation does not mean causation. Having an earlobe crease doesn't necessarily mean you have heart disease. It's just an indicator, a sign that you might want to get your heart health checked out just to be on the safe side. Remember, an earlobe crease doesn't guarantee heart problems, but it's a sign you should not ignore. Next, we have ringing in the ears. This annoying and often disruptive sensation is known as tinnitus. Tinnitus can be a temporary occurrence, like after a loud concert, or it can be a chronic condition that persists over time. While it's easy to dismiss this as an occasional nuisance, persistent ringing in the ears might be a sign of more serious health issues. For instance, it can be an early indicator of high blood pressure, a condition that can lead to heart disease. It's also linked to diabetes, a prevalent health concern that affects millions of people worldwide. Chronic tinnitus might even be a symptom of an underlying neurological disorder. So if you're constantly hearing a ringing, buzzing, or clicking sound in your ears, it's not something you should brush off. If you experience persistent ringing, it's time to consult a healthcare professional. Our third indicator is frequent ear infections. Now, it's quite common to experience an occasional ear infection, particularly in children. However, if you're experiencing these frequently, it might be a sign of a deeper issue. Ear infections are typically caused by bacteria or viruses, and they can lead to uncomfortable symptoms like ear pain, drainage, decreased hearing, and even fever. But why would these infections keep recurring? Well, it could be a sign that your immune system isn't as robust as it should be. Our immune systems are designed to fight off pathogens, but if it's weakened, these invaders might have an easier time setting up shop in your body, leading to infections. Besides, recurrent ear infections in adults might also indicate other health problems such as diabetes or HIV, which impair the immune system. It's important to seek medical attention if you're dealing with frequent ear infections to identify and address the root cause. So frequent ear infections might be your body's way of telling you that your immune system is compromised. Coming up next is vertigo. Now, vertigo isn't just feeling dizzy, it's a sensation of spinning, like you're on a merry-go-round that just won't stop. It's often caused by issues in your inner ear, which is your body's control center for balance. Conditions like Meniere's disease, vestibular neuritis, or labyrinthitis can all cause vertigo. But vertigo isn't just about your ears. It can also be a sign of migraines, a common neurological condition that causes severe headaches. Some people even experience vertigo as a symptom of stroke, although this is less common. This spinning sensation can be disorienting and scary, but it's important to remember that it's a signal from your body. It's your body's way of telling you that something isn't quite right. So if you're often feeling dizzy or losing your balance, don't just brush it off as clumsiness. It might be a sign of a more serious health issue. Remember, if you often feel dizzy or lose balance, it could be more than just clumsiness. Our fifth indicator is loss of hearing. Now, we're not talking about the natural, gradual hearing loss that can come with age. We're discussing sudden or rapidly progressing hearing loss, which can be a sign of more serious health issues. The causes of such hearing loss can vary, including exposure to loud noises, ear infections, or even certain medications. The symptoms are often straightforward, with individuals noticing a marked decrease in their ability to hear conversations or sounds around them. Now here's the crucial part. Sudden hearing loss might be a symptom of serious health conditions. Conditions like meningitis, An infection that causes inflammation of the membranes surrounding the brain and spinal cord can lead to hearing loss. Diabetes, too, can impact your hearing, as high blood sugar levels can damage the small blood vessels in the ears. So if you find yourself straining to hear, don't dismiss it as a mere inconvenience. Hearing loss is not just an inconvenience, it can be a sign of a serious health issue. The sixth indicator is fluid discharge. Now, this might seem a bit unsettling, but it's crucial to understand that fluid discharge from the ear is not a typical occurrence. It's often a telltale sign of something being amiss. This could be due to a variety of reasons. An ear infection, for instance, can often lead to fluid discharge. This is because the body produces pus or fluid to combat the infection. Another possible cause could be a perforated eardrum, a result of injury or loud noise exposure, which may lead to a leaky ear. Symptoms accompanying fluid discharge could range from pain, hearing loss, or even fever. These signs should not be ignored as they could potentially indicate a more serious underlying health condition. It's important to note that while some ear infections may resolve on their own, persistent or recurrent issues require medical attention. Remember, fluid discharge from your ear is not normal and should be examined by a healthcare professional. The seventh indicator is ear pain. Now, we all know that ear pain can be quite discomforting, but what causes it, and what could it potentially indicate about your health? Well, ear pain can be a result of various factors. It could be due to a simple ear infection, or even a sign of an injury. Infections are usually caused by bacteria or viruses, while injuries could be from inserting objects into your ear or exposure to extremely loud sounds. However, when it comes to persistent or severe ear pain, it's important to pay attention. This could potentially indicate more serious conditions. Certain types of cancer, such as throat or laryngeal cancer, can cause referred ear pain. Symptoms accompanying ear pain like difficulty swallowing, a lump in the neck, or voice changes should never be ignored. These could be signs of a serious health issue. Don't ignore persistent ear pain. It can be a sign of a serious health issue. Last but not least, itchy ears. Now, you might think that itchy ears are just a temporary nuisance, but this seemingly trivial issue could be indicative of underlying health conditions. Itchy ears can be caused by a multitude of factors. Allergies, for example, can trigger histamines in your body, leading to itchiness and discomfort. Certain skin conditions, such as psoriasis or eczema, can also manifest in the form of itchy ears. In such cases, you may notice flaky or red skin around your ear area. Now, let's not forget about infections. Yeast or bacterial infections can make your ears itch, often accompanied by pain or discharge. It's crucial to pay attention to these signs, as persistent itchiness could suggest a more serious issue. If you find that your ears are frequently itchy, it's worth scheduling a checkup with your healthcare provider to rule out any potential complications. Itchy ears might seem like a minor annoyance, but they could be a sign of something more serious. There you have it, 8 ear health indicators you should never ignore. From the subtle crease on your earlobe, the persistent ringing in your ears, to the often dismissed ear infections. We've also discussed the disorienting vertigo, the alarming loss of hearing, the concerning fluid discharge, the excruciating ear pain, and the irritatingly itchy ears. Each of these signs is your body's unique way of communicating potential health issues that might be lurking beneath the surface. Paying attention to these signs is crucial. Don't brush off a persistent ring in your ears or ignore an unusual discharge. These could be your body's way of alerting you to something more serious. When these signs present themselves, seek medical advice. Your health is paramount, and early detection can make a world of difference in treatment and recovery. Remember, your ears are trying to tell you something about your health. Are you listening?